It's great to be joined today by Travis Lupick, who is an Wait, you know what? Did you say Lupick or Lupick? Now I'm doubting.
Lupick.
You did. Okay. Lupick.
Happens all the time.
Take it from the top. Here we go. It's great to be joined today by Travis Lupick, who's an award-winning journalist and author of the book Fighting for Space: How a Group of Drug Users Transformed One City's Struggle with Addiction, referencing your work in Vancouver, which is very, very interesting. Let's start, Travis, if we can, with here's sort of just a fundamental question. Is there something uniquely different about the opioid epidemic that we're currently experiencing than other drug epidemics that we've seen in the past?
The drug crisis that all of North America faces today is different from similar crises of the past because of fentanyl. This maybe began in a lot of areas with prescription drugs, but it is now very much a heroin and a fentanyl crisis. For those who don't know, fentanyl is a synthetic opiate that's significantly more stronger than heroin. And usually, when users are taking drugs, they don't know that fentanyl, this dangerous substance, is in there. So there's that extra degree of uncertainty in the crisis we're facing today that makes this a really tricky problem.
With regard to how law enforcement and first responders are sort of trained and empowered to deal with apparent or potential or real overdoses. Talk a little bit about how you feel that things like police carrying Narcan and other sort of rescue medications relates to the broader treatment of this epidemic. Is that generally something that we like the results of or that we should be concerned about?
It's getting better, law enforcement's role in responding to this crisis. It wasn't until recently that a lot of police officers were even carrying the so-called overdose antidote naloxone. So it's good to see them involved. Interestingly, though, in Vancouver, police actually don't respond to an overdose call. When someone calls 911 for an overdose, that call does not go to a police department. It only goes to fire and ambulance, which the idea is hopefully removes a degree of hesitation that some drug users might have to call 911.
Yeah, and that gets to the sort of discussion around decriminalization versus legalization. And, you know, in the United States, when it comes to marijuana, there's sort of a patchwork of laws depending on the state that you're in. Of course, marijuana is still illegal at the federal level. And there's this big debate about decriminalization as a good first step towards legalization versus the idea that these are sort of two really separate paths with very, very different implications. Can you talk a little bit about that? I mean, practically speaking, why is the difference between decriminalization and legalization so important?
Yeah, I mean, I'm so happy you asked that question because I think it is one of the most important questions that we have in this debate on drug policy in the context of the crisis right now. Decriminalization deals with the demand side. So all decriminalization does is remove criminal laws that make it illegal for people to hold drugs for personal possession. Legalization goes the next step. It's much more complicated. It involves fully legalizing and regulating substances, sort of possibly similar to how we regulate tobacco and alcohol. So the idea, advocates for decriminalization say it would remove stigma, it would bring drug use out to the open, it would encourage people to seek help, seek treatment, but it would not solve the fentanyl crisis that we talked about earlier. Decriminalization would leave supply in the hands of dealers and organized crime, whereas legalization, the next step, would remove drug supply from organized crime and bring it under the control of government.
Right. So even in cases where we've seen legalization, like, for example, in Colorado in the United States with marijuana, it doesn't eliminate the black market, but it significantly reduces it. Does decriminalization do anything at all to deal with the black market aspect of the supply?
It really doesn't. And while I'm an advocate for decriminalization, this is why I think we have to be cautious about it. It's a first step, in my opinion, but it would not solve the fentanyl crisis. Supply would remain in the hands of organized crime, and organized crime would continue to really poison these drugs with fentanyl.
What about the public sort of stigma? I guess, or let me rephrase it a different way. Do you have any strong feeling as to whether legalization more drastically changes the public perspective on a particular substance compared to just decriminalization?
Yeah, again, I think decriminalization is an important first step because I do believe it would go a long way in changing public opinions towards drug use. If drug use is no longer a criminal matter, we can truly let it become a healthcare matter, and encourage people to seek treatment, to speak about it more openly because it won't be criminal anymore. Legalization would continue that process. It would sort of um, normalize drug use, and I mean that in a positive way. It would allow people to use drugs out in the open, not using drugs alone, where if they overdose, there's no one to catch them if they overdose.
Hmm.
It would it would allow us to control how the public perceives drugs. For example, a lot of jurisdictions have large warning labels on packages of cigarettes. We can do the same sort of thing with dangerous drugs as opposed to leaving marketing in the hands of organized crime where it is now.
Can you tell us more about what's been done in Vancouver? You already talked about how when you call emergency services for a possible or actual overdose in Vancouver, police don't respond. You basically have ambulance and firefighters, and that it's really dealt with as a health incident, not as a criminal incident. What else has been done in Vancouver?
Yeah, so first to give people an idea of the scale of the problem here, Vancouver's overdose crisis is about on par with Philadelphia's is a good comparison. About 50 overdose deaths per 100,000 people is the rate, and then that is an astronomical rate of overdoses. It's something really scary. In response, the government has taken some really radical measures, mostly since the winter of 2016. So when you call 911, police don't show up. The call only goes to medical and fire. We have essentially flooded the streets with the overdose antidote naloxone. It's free. You get it over the counter in pharmacies. You walk down the street in Vancouver, you see it clipped to people's belts. It's really everywhere. We've also opened a ton of new sort of low barriers, supervised injection sites, places where people can bring illegal drugs, mostly heroin, cocaine, and methamphetamine, and use them under the watchful care of staff who can respond in the event of an overdose. Vancouver, of course, established North America's first supervised injection site in 2003. But we only had that one site for the entire next decade. Since the winter of 2016, our city alone has opened more than half a dozen additional sites, and they're reversing overdoses every single day.
So there are people who will hear you talk about, supervised places to use for recreational drug use, and they'll say that in the net will increase the number of people engaging in risky behavior with drugs. What evidence do we have to push back against that talking point?
Yeah, and I do understand that talking point. There is logic behind it, but the data does not actually tell us that's what occurs. Insight, North America's first supervised injection site in Vancouver since 2003, is very possibly the most studied health intervention in our continent's history. There was data collected in the neighborhood around Insight before Insight opened, and data collected in the neighborhood around Insight after Insight opened, and it shows that there was no increase in drug use. What did occur is it brought people who were using drugs inside off the street into a safe place, brought them out of the alleys into a healthcare environment where there was where there was someone to respond to an overdose. Since these additional half dozen plus injection sites have opened in Vancouver since the winter of 2016, they've received over 200,000 visits. There's been hundreds of overdoses and not one death at any of them.
Hmm. Can you talk a little bit about how we can get accurate data about drug use? And the reason I ask that is that very often when you are making an attempt to compare a drug use rate prior to and after decriminalization or prior to and after legalization, you have to contend with the reality that people might be differently willing to admit to drug use based on the change in the status of a particular drug. So how does science and the statistical world account for that when we talk about pre and post drug use levels?
Sure. I mean, there is a challenge there. But especially in Vancouver, but also across the United States, researchers have been working on this question for a long time. Academic researchers, scientists, were actually really involved in establishing Insight. There was a couple of fantastic doctors named Thomas Kerr and Evan Wood who worked in the community for long enough to sort of build up a repertoire with drug users. There's all sorts of they build safeguards into this research now that sort of tries to compensate for different changes in people's opinions. This is pretty well established science now, in Vancouver at least more than 30 years old, and in a lot of areas in the United States, much more established than people might think.
Can you talk a little bit about where in the world we can look to for results about models that are sort of in the style of what's being done in Vancouver? I mean, I know colloquially people often like to talk about Portugal, and sometimes we'll incorrectly hear policy ascribed to Portugal that's not exactly accurate. So, sort of like what other models around the world are there that are relevant here?
Well, Portugal is a good one for us to look to. That's where they implemented decriminalization over a decade ago. But like you said, I agree with you. It's not a perfect comparison for North America right now because Portugal has never had to deal with fentanyl. And like we were saying a minute ago, decriminalization would not remove fentanyl from organized crime. So, but there are there's other aspects of the Portugal story that I think we should look at. When they decriminalized drugs, when they, in some people's minds, made drug use more acceptable, drug use did not increase. Drug use decreased. Overdose deaths decreased. The spread of HIV decreased. So the Portugal story is not perfect, but I think we can look to it because there's a lot of successes there.
We've been speaking with Travis Lupick. He's an award-winning journalist, also author of the book Fighting for Space, How a Group of Drug Users Transformed One City's Struggle with Addiction. Travis, really great work, and I really appreciate you talking to me today.
Thank you so much for having me on.